Student clinician Dan Mathis, 0255431. Hello, I'm student clinician Dan Mathis. What's your name?
Jeremy.
Jeremy, nice to meet you. Today I'll be performing an orthopedic examination. If anything I do hurts you at any time, please don't hesitate to tell me. If anything you tell me will be held in strict confidence. And if you have any questions during this procedure, please don't hesitate to ask. May I begin?
Yes.
Awesome. So I will be going through some lower extremity and lumbar spine tests today. The first one being minor sign. So what I would have the patient do is I have the patient stand up and observe for abnormal motion for them standing up. The positive would be patient needing support in moving from the seated to standing position, such as a leg on the back of the thigh, or hand on the back of the thigh. This would indicate sciatica or lumbosacral or sacroiliac joint lesions. The second test would be belt test, so if you can stand up for me. I'm going to have you move forward a couple steps. I'm going to stand behind you, like so, and I'd like you to bend forward at the waist for me, and I'll stabilize there. There we are. And back up. Any pain with that?
No.
Cool. Positive would be low back pain. This would have two indicators. The first being the pain with bending, and the sacrum stabilized and unstabilized would equal lumbar involvement. If you have pain in the sacrum during non-stabilized bending or no pain in the sacrum during stabilized bending, that would equal pelvic involvement. The next one, if you can take a seat for me, is Valsalva maneuver. So I'd like you to take a deep breath, hold it, and bear down as if you're having a difficult bowel movement. There we are. Perfect. Relax. Any pain with that?
No.
Positive would be pain radiating from the site of the lesion, usually recreating the complaint in the cervical, thoracic, or lumbar region. And this would indicate nerve root entrapment by a disc lesion, possibly a space-occupying lesion. Next, I'll be doing heel walk test. If you could stand up for me. We're going to walk over here, right here to the edge of the couch, turn around.
Okay.
And I'd like you to walk on just your heels forward. And I'll be here to catch you, stabilize you. Awesome. And let's turn around and go back on heels. Good job, good job. Okay, you relax and stay right there for me. Positive would be inability to perform the test, which would indicate an L4 to L5 disc lesion on the L5 nerve root. Now, I'd like you to do the same thing there and back, but on your toes only. There we are. And we're going. I got you. I'm right here for you. And then turn around. Good job, good job, good job, good job, and relax. Positive for that would be an inability to perform the test, which would indicate an L5 to S1 disc lesion, usually on the S1 nerve root. Kemp test would be the next one I'm going to do. So if you want to walk over here, stand right there for me. Now I'd like you to, can you cross your arms in front of your chest, across your chest? Perfect. Now I'm going to stand behind you. I'm going to grab this shoulder, stabilize you here. I'm going to bring you back. Awesome. And then I'm going to bring you back. Awesome. Is there any pain with those? No. Awesome. There are two positive with this. The first being pain, usually radicular, recreating existing sciatic pain, which would indicate a disc protrusion. In the medial, if the disc protrusion is medial, Kemp's will be positive as the patient is leaning away from the side of pain. If it's a lateral disc protrusion, Kemp's will be positive if the patient is leaning into the side of pain. The localized pain, the second one would be pain, localized pain, indicating lumbar spasm or facet capsulitis. The next one will be straight leg raise, so if you can lay down on your back, please. So I'm going to take your leg here, straight, raise it, raise it, raise it, raise it, raise it. Any pain with that? Nope. Awesome. Positive would be radiating pain and or dull posterior thigh pain, indicating sciatic radiculopathy or tight hamstrings. If the positive occur between 35 to 70 degrees, that's a possible discogenic sciatic radiculopathy. If the positive occurred at greater than 70 degrees, it's most likely tight hamstrings. Next would be Bragger's tests. So I will again lift your leg straight up. So there's an area of pain, then I'll go back down to 5 degrees, and I will dorsiflex the foot. Any pain with that? Nope. Awesome. Positive with that is pain in the posterior thigh, indicating sciatic radiculopathy. The next would be a Sicard test. So the same thing. Lift your leg, start doing a straight leg raise, straight up. Go to about 5 degrees before pain, and I'll dorsiflex your big toe. Any pain with that?
No.
Awesome. Pain would be positive would be pain in the posterior thigh, indicating sciatic radiculopathy. Next will be a Lindner test. So I will take you on your back, take your head, and flex it to your chest. Any pain with that?
No.
Awesome. Positive would be pain in the posterior thigh or leg, indicating sciatic radiculopathy. Next will be Turin test. So I will come down here while your leg is on the table with no hip flexion. I will dorsiflex your big toe. Any pain with that?
No.
Positive pain in the posterior thigh, indicating sciatic radiculopathy. Next is Bonnet test. So I will take your leg. I will rotate it, bring it across the midline, and then I will bring it up. You aren't any pain with that?
No.
Awesome. With that one, again, positive is pain in the posterior thigh or leg, indicating if it's immediate pain, it's sciatic neuropathy from piriformis syndrome. Next will be well leg raised test. So I will take, let's say you're having pain in your left side, so I'll take the right leg instead, bring it up to about 75 degrees, and then back down. Any pain with that?
No.
I'll bring it up if I was bringing it up to 75 degrees, I would do that to getting to 75 degrees or until there's a reproduction of pain down the unaffected leg, or down the affected leg, which would be the left side. This has two positives with it. The first being pain down the affected leg, being the left leg, which would indicate medial disc protrusion. The second positive, if there's a decrease in pain down the affected leg, being the left side, then it would be a lateral disc protrusion. Next will be the femoral nerve traction test. So let's say if you're having a left side issue, then I would have you lay on your right side, so if you can flip onto your right side for me. And if you could slightly flex your hips and knees, there we are, like that. And then I will have you straighten your back for me. I will flex your neck. Then I will bring your knee backward, I believe. Yeah. So I will stabilize your hip, bring your leg back to about 15 degrees and back over. Any pain with that?
No.
So for that one, we're stretching the femoral nerve at approximately 15 degrees. Positive would be pain on the anterior portion of the thigh, indicating traction on the femoral nerve, indicating involvement of the second, third, and fourth lumbar nerve roots. Bless you.
Thank you.
Next will be Tenel foot and ankle test. So if you can sit up for me and swing your legs forward, put your feet on the ground. So this is my Taylor reflex hammer. It's used to test sensation. I will tap you such as this. Boop. Is that okay?
Yep.
Awesome. So then I will take, get this thing firing again. I will take your foot here, and I'll tap right behind your medial malleolus. Boop. Ooh. Any pain with that? No. Possibly paresthesia radiating into the bottom of the foot. That would indicate tarsal tunnel syndrome. And the last would be Morton test. So I will take your same foot here. That. Squeeze. Compress. Any pain with that? No? Awesome. Positive would be sharp pain in the forefoot. This would indicate metatarsalgia or neuroma, usually of the third or fourth metatarsal interspace. And this concludes the Week 8 lab video. Thank you very much.